The International Foundation for Functional Gastrointestinal Disorders designates April as Irritable Bowel Syndrome Awareness Month. IBS affects between 25 and 45 million people of all ages in the United States. The specialists at Advanced Gastroenterology and Surgery Associates explain what irritable bowel syndrome is, how it's diagnosed, and how it's treated.
Irritable bowel syndrome is a chronic condition, and it's the most common reason that we actually see a lot of patients, maybe outside of acid reflux. The one good thing about irritable bowel syndrome that I tell patients is that it won't kill you. You may feel as though you're dying, but you're not. If someone has chronic abdominal pain associated with changes in bowel habits, and it's been going on at least 3 times for the past 6 months to a year, then you can, by what's called the Rome criteria, diagnose them with irritable bowel syndrome. Now, of course, these are patients without warning signs, meaning no weight loss, no poor appetite, no blood in the stool. And it can be divided into diarrhea predominant, meaning that the patients mainly have diarrheal symptoms, or they can be constipation predominant, where patients have mainly constipation, or you can have both, alternating constipation and diarrhea. But it has to be abdominal pain associated with changes in bowel movements. And then, if everything else is there are no other warning signs, then you can make the diagnosis of irritable bowel syndrome. There are many various things that potentially could cause it. Patients usually have more stressful situations when they get their symptoms. We know that something triggers it. It could be virus, could be bacteria, could be a food toxin, but it triggers this abdominal pain with changes in motility of the bowels, and in the majority of patients can be sort of chronic. Patients, like I mentioned before, who have the diarrhea predominant type, you'll want to check for things like celiac disease, just to make sure that's not playing a role. Since the advent of the probiotics, they have helped a lot in controlling a lot of symptoms, especially in someone who we think there was a triggering factor from a virus or antibiotics. We know that the colonic bacteria is very important, so replenishing the good bacteria in the colon is crucial.
We've included links to more information on IBS as well as contact information for AGSA when you click the IBS Awareness Month story link on our homepage, yourhometownhealth.com.